category is mucolytics. So this is going to be a drug that facilitates the removal of mucus from the respiratory tract. First up, we have acetylcysteine. The brand name is Mucomist, and it basically just lowers the viscosity of mucus, so it decreases the thickness of it. This is indicated for patients with abnormal mucus secretions and bronchopulmonary diseases, pulmonary complications of surgery, and cystic fibrosis patients. The contraindications include hypersensitivity to the drug and caution in asthma patients because the mucolytics can cause bronchospasms, so you have to administer it with a bronchodilator. And one thing I forgot to mention on the corticosteroids is you have to instruct your patient, honestly with all inhalers, you have to instruct your patient to wash out their mouth, brush their teeth, whatever, after using those, just because it can cause thrush over time. So back to this one, the Mucomist, like I said, lowers the viscosity of mucus. The contraindications is, like I said, caution asthma patients because it can cause a bronchospasm, which is the side effect. It's normally a 6 to 10 milliliter, 10% solution. And the form of delivery is a small volume nebulizer, and it helps clear the mucus in the patient's lung. Next is Dornase Alpha, and the brand name for this one is Pulmozyme. It, just like the last one, decreases the mucus viscosity. The indication this is for cystic fibrosis patients. If there is any hypersensitivity to the drug, it's not recommended for the patient to take it. Side effects include abdominal pain, chest pain, pharyngitis, rhinitis, and bronchospasm. It's 1 ampule per day, delivered by a small volume nebulizer, and it helps clear the mucus out of the lungs. Next, we have hypertonic saline. There aren't any brand names for this one. The mechanism of action is the same as the last one. It reduces the viscosity and elasticity of the mucus. It's used in cystic fibrosis patients, and it's normally paired with an airway clearance therapy. So the contraindications is congestive heart failure and renal insufficiency. The side effects include increased cough, sore throat, and chest tightness. The dose and frequency can depend on the severity of the patient's issues. So it's pretty much determined by kind of what the patient is experiencing. So it can be 0.9%, 3%, 7%, or 12% concentrations. And they would get that twice per day through the small volume nebulizer. It increases the mucus clearance, helps maintain lung function, and reduces the frequency and duration of exacerbations. Next, we have antibiotics. So the first one is colisomethate. The brand name for this one is colimycin. It interacts with the bacterial cytoplasmic membrane and changes its permeability. It's indicated for cystic fibrosis patients. The contraindications is hypersensitivity to the drug. Side effects include dizziness and upset stomach. The dose and frequency is 150 milligram powder vials mixed with 2 milliliters of sterile water. And this just works by decreasing the infection caused by bacteria. So the next one is tobramycin, and the brand name is Toby. This inhibits protein synthesis, and it's indicated for patients with respiratory infections and patients with cystic fibrosis. Contraindications, again, is just hypersensitivity to the drug or its components. Side effects include nausea, fever, and vomiting. The dose and frequency is 300 milligrams every 12 hours for 28 days, and that's through a small volume nebulizer. Next, we have alpha and beta adrenergic agonists. This is just epinephrine. The brand name is EpiPen or EpiPen Junior, which that is for kids. This stimulates alpha and beta adrenergic receptors. It treats severe allergic reactions. So the contraindications on this one is diabetes, hypertension, and coronary artery disease. Side effects include nervousness, pounding heart, nausea, headache, and dizziness. The dosage is going to be 1 dosage from the EpiPen. So the regular adult EpiPen is a 3 milligram dosage, and the EpiPen Junior is 1 dosage is 0.15 milligrams for a child. And the form of delivery, it is an injection. It acts quickly to improve the breathing and stimulate the heart, raising a dropping blood pressure, reverse hives, and reduces swelling on the face, lips, and throat. This is also used when a patient is bradycardic or crashing. Next is an antiviral. It's called ribavirin. The brand name is Ribitol. It mediates direct antiviral activity against a number of DNA and RNA viruses by increasing the mutation frequency in the genomes of several RNA viruses. Young children, it's used in young children with low respiratory tract infections. Contraindications are anemia, cardiac disease, and sarcoidosis. Side effects are cough, upset stomach, vomiting, loss of appetite. It's a 6 gram per vial dose delivered through a small volume nebulizer, and it stops the spread of viruses. All right, so this one is an antiprotozoal. The name is pentamidine, and the brand name is Nebupent. It is an anti-infective agent that treats or prevents pneumonia. Indications for this one is any patient who is at a high risk for pneumonia. The contraindications include diabetes, dehydration, and anemia. The side effects are fatigue, metallic taste, cough, and dizziness. It's a 300 milligram dose once every 4 weeks delivered by a small volume nebulizer. It stops the growth of protozoa that can cause pneumonia. Next is an anesthetic. This is propofol. The brand name, one of the brand names is Dipravin. The mechanism of action is it induces hypnosis, which it's used to put patients to sleep. So if a patient is going into surgery, they could use this to put them to sleep and put them under general anesthesia. Contraindications is a prolonged QT interval on the EKG, low blood pressure, and seizures. Side effects can include bradycardia or tachycardia, high or low blood pressure, which that just depends on the patient, apnea, rash, and itching. The dose is 10 milligrams per milliliter. It's an injection or through the IV, and there are minimal residual effects on the central nervous system compared to other medications. Next is an immunoglobulin antagonist. So, you want me to be honest? I don't even know how to say that generic name, so I'm not going to try it. But the brand name is Xolair. It inhibits the binding of immunoglobulin to the high affinity receptor on the surface of mast cells and basophils. It's indicated for allergic asthma, so people that have allergies that trigger their asthma. Contraindications are cancer, inflammation of blood vessels, increased risk of cardiovascular event. Side effects include blisters, muscle pain, stiffness, joint pain, and stomach pain. The dose on this one is a 150 to 375 microgram injection every 2 to 4 weeks. And it's an injection. It decreases the number of asthma attacks in a patient with moderate or severe asthma. And that is it. So yeah, just to show you what has been making me laugh the whole time. This guy decided to wake up from his nap. So there's your presentation.